Our goal is to provide higher quality medical care faster and at lower costs. But the question is, where do we start? Where do we focus our energies? And gap analysis is a tool that we can use to identify problems to solve. In gap analysis, what we're doing is we're comparing actual performance to desired performance in things like clinical outcomes, efficiency of care, timeliness of care, and satisfaction of patients, caregivers, clinicians, and others. And what we do once we've identified the gaps is we prioritize them and then we address and resolve them. We're looking for missing links in the organization. So how do we quantify gaps? And the answer is we quantify them in terms of time, money, human resources that are required for things like clinical outcomes, encounters of different types, individual cycles in specific processes. And all of this is internal data related to quality in the organization. But internal data makes a lot more sense, is a lot easier to interpret when we compare it to external data. And benchmarking data from other organizations is widely and easily available. For example, in the United States, Medicare publishes databases on an ongoing basis giving explicit, detailed quality information about a wide range of different types of medical organizations, and that data can be downloaded and imported into analytics software. Very similarly, state organizations also track medical activity. In California, there's OSHPD, which provides detailed census data about medical organizations, so that these different types of government data sources can be downloaded, imported into software. You can segment them to find organizations of similar sizes and similar demographics doing similar types of work to be able to create a cohort group of other medical organizations that you can track together. Similarly, PubMed is an excellent source of more qualitative papers about clinicians struggling to develop best practices in each of the areas in which you work. Another thing that can be done to identify and quantify gaps is to interview stakeholders, to ask them what their points of pain are, how much they think those points of pain cost in terms of tangible and intangible factors. And then team meetings of work groups that may include some stakeholders can give continuous feedback about what can be improved, what the problems are, how things could be improved, and that type of data can enable us to figure out what the gaps are and what the costs of the gaps are, how much benefit could be gained by addressing some of those gaps, bridging some of those gaps, resolving some of those gaps. Now, it helps to look at some specific examples rather than speaking in more abstract terms. So some examples of gaps are things that reduce quality and cost money. And a few examples might start with an intake process. These days, with medical records being what they are, an intake process in a medical organization might involve a new patient having hundreds of pages of data, medical records from other organizations that are faxed into or sent into a medical organization at the point of intake. But yet the physician or nurse, the clinician who's responsible for doing the intake, might only have time for a brief initial encounter. So there's really a huge gap between the amount of medical records that are available about a new patient and the amount of time that the organization has to spend analyzing those medical records. And that gap can be bridged by algorithms that might process data coming in about the patient so that salient points can be brought up that can coach the physician to ask the types of questions they'd like to ask, which can improve the quality of care, can enable better care team to be assembled, and better clinical outcomes to be brought about in shorter periods of time. Another example is inefficiency of supplier relationships. Some medical supplies required for certain types of encounters can be very, very expensive. For example, chemotherapy bags can be extremely expensive, and when an encounter is scheduled, then information needs to be sent from your organization to the payer, And the payer then has to send money to the supplier, and the supplier has to send supplies to your organization in order for the encounter to actually be fulfilled. And delays in this process can cost not only problems with money in terms of inefficient use of your staff time, they can also be expensive in terms of the quality of care that's delivered to the patient. And other examples might be surgical supplies and a wide range of other types of things. And this is an example of a gap. Another example is excessively frequent readmissions to the hospital for the same diagnosis. For example, if someone comes in and is treated in the hospital and then discharged with specific instructions to help the patient manage their symptoms, and those discharge instructions are not effectively used by a care team, then the patient's symptoms may get to the point where they need to be readmitted to the hospital a few weeks later unnecessarily. I mean, it is necessary at that point in time, but a tremendous amount of patient discomfort has been created in that situation, and financial implications occur in the United States as well. So here are 3 examples of the types of gaps that we might encounter if we do a gap analysis in a medical organization. And as we start thinking, we realize that we could come up with a very long list. So how do we address gaps? Well, we can address gaps by agile development of custom software. Essentially what we're doing is we're changing the way that your workflows and we're changing the way that analytics are used in your organization. But we're doing that by embedding software into your evolving workflows. This can reduce the cost of care delivery, it can increase the timeliness of care, and it can improve clinical outcomes. And altogether, these things mean that agile development can pay for itself. But none of this is happening in a vacuum. This is just one piece of the picture. And if you want to see other pieces of the picture, at healthprocesspartners.com, we've got some other related videos. If you want to understand how the software pieces work that can be built up to do this, we've got a 5-minute video called Adding Logic to HL7 Interfaces, which describes how custom apps can easily emerge from simple HL7 interfaces starting as soon as 6 weeks. And we also have a video about the management process involved in creating solutions to these gaps that we've discussed in this video. And that video is called Agile Healthcare Management. Both of those videos are available at healthprocesspartners.com.